DoMore, an ICT Lighthouse project funded by the Norwegian Research Council. In Western countries, health budgets amount to 12 to 15% of gross domestic product, of which up to 30% is due to errors in diagnosis and other unwanted events. Cancer cases worldwide are expected to increase from 14 million to 22 million within the next 2 decades, placing further strain on already overstretched health services. For example, in Norway, the cost saved from one prostate cancer patient not overtreated with surgery is 135,000 Norwegian kroner. Consider all the potential risks associated with this procedure, such as impotence and incontinence. Here is an opportunity for great impact, beginning with individual patients and extending to society and the healthcare system as a whole. At ICGI, one of our key areas of research is heterogeneity. Cancers are heterogeneous and can follow multiple paths. Some will progress to metastasis and death, while others will remain indolent. A single tumor can contain multiple regions of different genetic or epigenetic aberrations that are not distributed evenly throughout the tumor. Sampling for most markers is generally performed on a small fraction of a single block of tissue. Using prostate cancer as an example, the sample examined is a mere 1 to 1,000 of the tumor. This small sample size means there is a greater risk of missing the cells that actually go on to kill the patient. Grading the sample and giving a correct diagnosis depends heavily on the pathologist's expertise. Pathologists assessing the same sample can arrive at vastly different conclusions. Furthermore, the manual laboratory procedures needed to render a diagnosis are time-consuming, and the shortage of pathologists only add to the increasing difficulty to keep up with patient demand. The need for automation and assistive digital tools in pathology has never been greater. By using concepts based on image analysis and more specifically on deep learning, texture analysis, and quantification of DNA, DoMore aims to completely transfer today's very complex thinking and decision-making, currently based on visual observation, to a digitally driven process with objective, reproducible algorithms. This will involve exploiting technology that has been in development at ICGI for over 15 years and tapping into the vast reserves of patient data stored in hospital databases. We seek to develop a broader understanding through modeling heterogeneity in 3 common forms of cancer: prostate, colorectal, and lung, together accounting for 44% of all cancer deaths. This will allow us to design more robust, generic grading systems. The combination of digital pathology and laboratory automation will reduce human error and remove subjective and time-consuming analyses. Patients will experience these gains through more precise diagnosis and more targeted treatment, resulting in fewer cases of overtreatment and thus a better quality of life. The implementation of this project would be groundbreaking. For the Public Health Service, these new methods will be of such great value that their benefits will far outweigh the initial investments. Most importantly, though, we will be able to do more for patients.